Thank you and good afternoon. Today we have 536 new cases diagnosed with COVID-19 in British Columbia, 6 of whom are epidemiologically linked cases, bringing our total number of people diagnosed with COVID-19 to 59,608. Of the new cases, 102 are people in the Vancouver Coastal Health Region, 253 are in the Fraser Health Region, 21 people are in the Vancouver Island Health Region, 115 people are in the Interior Health Region, and 45 are in the Northern Health Region. We now have 4,624 active cases, of whom 362 people are in hospital, 74 in critical care or ICU. Additionally, there's about 7,303 people under active public health monitoring, and 52,605 people have recovered from COVID-19. In the last day, we've had an additional 7 people in British Columbia who've died from COVID-19, bringing that total to 1,038 people in BC. As always, we think of those families, the caregivers, care providers, and the communities that mourn the loss of 7 more of our seniors and elders. Our thoughts and our prayers are with you. We have 2 new healthcare outbreaks at Brocklehurst Gemstone Care Centre and Maple Ridge Seniors Village, and 2 are now declared over. The Suwatal Lalem outbreak here on Vancouver Island, and the Veterans Memorial Lodge as well. That leaves us with 52 active outbreaks in long-term care and assisted living and 12 in acute care units, involving 1,454 residents of long-term care and 776 staff now with active cases. Since the start of our immunization program, up until yesterday, we've immunized 69,746 people in every health region and some very remote communities across British Columbia. Right now, our focus, as we know, is on those who are at highest risk. And we are tracking and reporting on this daily, and we are building a dashboard that will make this more available in some detail for you as early as next week. As our supply increases and immunization programs expand to more and more people in the province, this process will become more complex and more challenging for all of us. And I'm very pleased that Dr. Penny Ballum, as we mentioned yesterday, has joined our BC immunization team as the executive lead to support the scaling up of efforts that we are going to need. I know many people are also wondering about when they will show up in the vaccine access column, and we have put out some details about Q1, so between now and the end of March, the people most at risk and people who are supporting our healthcare system are the priority, and we are working on giving details about everybody else, starting when we expect to see additional vaccines starting in April. And we will be providing details of that next week, so please be patient. We have a lot of considerations that need to go into this. We're still working on the issues of how much vaccine we expect to receive when, but we will be having more details provided in the coming days. Also want to talk today about the new variants that we have seen here in British Columbia. As you know, there are a number of COVID-19 variants that have arisen around the world that have caused increased concern, and we are paying close attention. We have been screening, both doing random samples of some of the isolates that have arisen, and screening as well on people who have traveled. And we now have 4 confirmed cases of the UK variant in British Columbia, 3 of whom are linked to one specific traveller, and 1 related to an additional traveller. There are no other contacts, and we don't believe that this has spread at all from these 4 cases. In addition, in the last day or so, we've also identified our first case of the South African variant of the COVID-19 virus, and this is in a person who has not known to have traveled or to have connection with a traveler. So we are still investigating where this person might have contracted this virus, and that will continue. It is, of course, concerning that we don't know where this arose. However, at the moment, it does not appear to have spread in the community beyond the person that we've identified. Both of these new cases, the fourth UK variant and the South African variant, were identified in people who live in the Vancouver Coastal Health region. As you know, we do have concerns that some of these variants, particularly in the UK, may allow the virus to spread more easily. And that is why it is important for us to continue to monitor and to do the whole genome sequencing that we've been doing in terms of surveillance for these variants. It's also why it is so important for all of us to continue to take those measures to prevent the spread of COVID-19. That means not gathering. It means keeping your contacts small, making sure you're using your protections, following and closely monitoring your personal health, and if you have any symptoms at all of concern, to make sure that you get tested. I have spoken many times before about how we are in different boats, how our experiences are unique through this pandemic, even if we are all in the same storm. Here in British Columbia and around the world, we have far more in common than what separates us when it comes to COVID-19. We are all susceptible to getting ill from this virus, and we all have a choice about our daily activities and how we treat those around us. COVID-19 doesn't discriminate, but systems do. And it has illuminated for us many long-standing inequities in different parts of our society. It has also highlighted how First Nations, Métis, and Inuit peoples in British Columbia did not come into this pandemic on equal footing. Recently, I have been very saddened and disturbed to hear reports of discrimination and racism that is counter to the kindness and compassion that we expect and have seen in British Columbia from so many people. In particular, members of the Cowichan tribes here on Vancouver Island have been stigmatized and discriminated against as a result of COVID-19. I'm pleased to receive reports that the tribes themselves, First Nations Health Authority, the local island health public health teams, as well as many others, have responded quickly and collaboratively to support those who have COVID-19 and who are self-isolating and caring for each other. This type of racism cannot be tolerated, and I stand against this with my colleagues to say this must stop on Vancouver Island and elsewhere. Racism has no place in our society, in our communities here in British Columbia, and we must all take the time to speak up and speak out. The health challenges that come with this virus are difficult enough without also having to face stigma and discrimination from those around us. We must go beyond good intention, and each of us find opportunities to take anti-racist actions. The Northern Health Indigenous that while we stay apart, we must find ways to safely connect and promote a spirit of unity, compassion, and support. Using your layers of protection helps stop the spread of COVID-19, and your individual efforts and actions can help to stop racism and discrimination. That also needs to start today. COVID-19 is our shared challenge, and one we will only get through by supporting each other. We face these new challenges every day, but there is an end in sight now. No matter where we are in the province, choose unity over division. Take a few minutes to learn about healing in pandemic times. And as always, remember, we will get through this by being kind, being calm, and being safe.
Thank you very much, Dr. Henry, and I wanted to start by expressing my condolences, that of the government, I think that of everybody in BC, to the families, the friends, the caregivers, the communities of the 7 people who passed away from COVID-19 in the last day, 6 of whom lived in Fraser Health and 1 on Vancouver Island. This is, I think, an extraordinary and difficult time to be dealing with the issues of grief, especially in some of those cases which occurred in long-term care homes in the Fraser Health Authority. And we are with those families and thinking of them today, and our hearts go out to all of them. I wanted to note that in our healthcare system today, in terms of our of on the acute care side, we are at 89.9% of base beds and 71.1% of overall beds filled. Typically this time of year, it should be understood that that number is 100% of base beds. So we are continue to be in good shape in terms of beds, although the stress in parts of our acute care system is very much there, and you can tell that by speaking, as I do regularly, to people working in the system. In critical care, 77.8% of our critical care beds are currently full. Those are the base beds, and 54.2% of the overall beds. We have, as Dr. Henry has said, 44,624 active cases of COVID-19, and we continue to be concerned, as Dr. Henry has said, with the situation in Interior Health in particular today, and in Northern Health, where at least since the Christmas period we've seen an increase in the number of cases, and we continue to be concerned in it and remind people everywhere in the province of the need to dig in right now and to follow public health orders and to express our solidarity and support for everyone working in healthcare in all regions of the province, but in Northern Health and Interior Health as well, where they have not seen it, sometimes in the pandemic, as many cases, but they're certainly seeing their share now. As 69,746 doses of vaccine delivered, as you will have guessed. New vaccine has arrived. Since we spoke yesterday, approximately 25,000 doses of the Pfizer vaccine. We're expecting more Moderna vaccine before the end of the week, and that allows us to continue across health authorities to pursue clinics everywhere. And our focus continues to be on long-term care workers, were urgent and non-urgent scheduled surgeries, and 47,477 were unscheduled or emergency surgeries. We reported in detail on this with Michael Marchbank, who is directing the surgical renewal commitment for the province last week, and I encourage you to go on the Ministry of Health website and review those reports. In addition, I'm happy to report that in the period over the Christmas period, from December 21st to January 3rd, we have updated numbers that the total number of surgeries completed was 6,078 in that period. That's from December 21st to January 3rd, and that is 595 more surgeries than the same 2-week period last year. That is an achievement by our healthcare teams. Briefly, to bring you up to date on the contact tracing recruitment initiative, an additional 13 roles were filled this week. That's 1,326 individuals hired, which is obviously more than the 500 initially announced in August by the Premier. We also have 369 candidates in the interview stage and 124 candidates in the offer stage. As there are significant candidates in the pipeline, discussions are underway around whether these will be accessed for continued contact tracing work, or if there are other opportunities to access these candidates, or there are opportunities to access these candidates for other roles. I want to thank everyone doing this work, and the addition to our existing teams of 1,326 people shows our commitment to that work. I think the Premier talked today about our Health Human Resources initiatives to support senior services in BC, and that is of 3 components, adding up to a hiring over the in the next period of 7,000 individuals, 2,000 to support visitation and long-term care and assisted living, 3,000 healthcare support workers, and approximately 2,000 more to fill existing vacancies. Approximately 1,284 FTEs have been hired to support visitation, so that's the first category of 2,000. In addition, 5,085 participants have entered the HCAP, that's the Healthcare Assistant Program participant pool after clearing preliminary checks. And since the middle of November, in addition to that, another 1,500 expressions of interest have been submitted, and the interest in the program continues to be high. I should say that on December 11, 2020, 2,527 HCSWs were allocated across 349 Phase 1 sites, including 101 early adopter sites, and hiring is complete for the early adopter sites, with 92% of the seats being filled. All of that is a significant effort to support not just senior services now, but into the future. I'd also note that in addition to the work that has been done in long-term care, I would note that especially in the lower mainland, where a significant number of outbreaks have occurred, Vancouver Coastal Health and Fraser Health staff have worked in leadership positions at outbreak sites from the beginning of the pandemic, but in particular since November. This includes staff to support those sites. As you know, our long-term care system includes health authority owned and operated sites. That's about 3 out of every 10 publicly funded beds, and for-profit and not-for-profit public beds in other sites. That's the majority of beds, but certainly there's no distinguishment between the two. Currently, today, as of yesterday, I should say, for a snapshot, about 96 VCH staff were deployed to outbreak sites. In other words, they volunteered to support those sites, and 116 staff in Fraser Health have done the same. And I want to just express my appreciation to them, to the families, to the residents in long-term care in what has been a very, very challenging and difficult time. We know, and we've known from the beginning, and that's why from the beginning, with the single site order, the decision to provide PPE, even though contractually it's not required, when it was a requirement of our providers who are in the private facilities with public beds. They were included in the supply chain. All of the efforts at infection control, adding workers as discussed here, and other supports. Because we understand, since visitation has been limited from March and then changed in July, that is a primary place that communities with their significant community outbreaks has an impact on healthcare workers who are going in and working in long-term care. You'll see when you review today's outbreak reports that more than 600 people have passed away in long-term care, and that shows the vulnerability of people in long-term care to COVID-19. In comparison, a much smaller number, I think it's less than 15, have passed away at assisted living sites, and only less than a handful have passed away at independent living sites, which tells you that vulnerability and the vulnerability that people face there and the very significant challenges. So we are appreciative of all the work that's being done. We understand from the beginning, and that's why we've taken so many efforts and steps over time to try and protect long-term care homes, and we'll continue to do that. Because we know that long-term care homes, to be successful, require people to go in and provide services directly to people, to provide those direct services to people in some of the most personal of ways, whether it's providing baths or helping people go to the washroom or helping people to eat and providing care and sustenance in many ways, social and others. And so the challenge for those workers is considerable, and the challenge of keeping long-term care safe is considerable, and I am very appreciative of the role that everybody's done and everybody in the system's done. And I want to reach out to family members who I've spoken to from the beginning of the pandemic, who are dealing with the circumstances that I know personally of being separated from loved ones often, and the anxiety that produces, particularly when a site where someone you love is involved in an outbreak site. It is a moment that nobody who's been in those circumstances will forget. And we think about that, we work on that every single day. Our work is not done, whether in our essential services like healthcare, transportation, food supply, pharmacy, or restaurants, or in our communities, workplaces, or households. Our work is not done. For each of us, no matter our calling, no matter where we live in BC, no matter all that we've done to stop the spread so far, our job always, our priority always, our focus always, and our duty still is to stop the spread, to use the skills we've learned, the guidance we've been given, the masks we are required to wear, or other PPE essential to our work that we choose to stop the spread. We must each stay 100% all in our commitment to stop the spread. Right now, we must also stay committed to the tolerance, kindness, empathy, and forgiveness that have made our BC fight uniquely our own. I agree entirely with the comments made by Dr. Henry today with respect to racism. We must, at this time, do everything we can to stop that pandemic, too. And we must qualities, the ones that we are so proud of to each other and to ourselves. In doing that, we'll make the future we've been working towards a better one. Now more than ever, and with more of us now than ever before, we must stop the spread.